The last topic in this section is a change in senses. There are 5 senses of the human body: taste, smell, touch, hearing, and sight. Each system collects information that causes stimulation and sends a message to the brain to form a perception. The first sense we will talk about is vision, or sight. The loss of vision is not a normal part of aging. However, everyone's vision does change with age. Most of these changes are minute, such as near or far-sightedness, and can be corrected with glasses, improved lighting, or large print. Vision loss can affect the nutrition status of an elderly person by interfering with driving to the grocery store, shopping for food, reading nutrition labels, and counting money. This may become so frustrating to an elderly person that they may stop buying needed food items, which can decrease overall nutrition status. Changes in the sense of hearing is caused by exposure to daily noises such as traffic, construction, loud music, noisy offices, or machines. These changes occur very slowly over time, and most may not even recognize them. According to the National Institute on Deafness, approximately 30 to 35% of adults aged 65 to 75 and 50% of those over the age of 75 in the United States have some degree of hearing loss. This loss may lead to frustration from not being able to hear others that surround them and may contribute to social isolation and eating alone. These 2 factors increase the risk for poor nutrient intake. The sense of touch recognizes pressure, temperature, pain, and stretch. With age, nerve endings decline and show a decline in the sensations of touch and recognition of textures. With age, taste buds tend to decrease in amount and remaining taste buds tend to lose mass. The mouth also begins to produce less saliva, which has an effect on taste. The sense of smell is the last sense we will discuss. Due to environmental exposures to the nose, receptors that recognize smells in the nose are subject to damage and are not replaced. This leads to a progressive decline in the sense of smell with age. The loss of nerve endings in the nose may also contribute to this decline of the sense of smell. Taste and smell work together to aid with food selection. The age-related changes that happen to taste, smell, and touch may lead to poor appetite, inappropriate food choices, and lower nutrient intake, therefore increasing the risk for malnutrition. In addition to the physiological changes that happen with aging, older adults also have psychological and social changes that happen with age. We will first begin by talking about the economic changes with age. Adults have jobs that supply them with income to purchase shelter, food, clothing, and entertainment. As one ages, there comes a time when they end their careers and retire. When an individual retires, the steady income they have been living off of for so many years decreases immensely. They must now rely on other sources of income, such as Social Security, pensions, savings, and income from assets to live on. In 2008, the average overall income for senior citizens was $29,248, and the median income of this population was $18,208. Due to Social Security benefits, poverty rates have decreased drastically over the past 50 years, yet still 20% of those over the age 65 still live in poverty. This low mean of income has a big effect on food choices, eating habits, and nutrition status in older adults. Those of low socioeconomic means are more likely to have an inadequate food and nutrient intake. Foods such as fresh fruits and vegetables and fresh lean meats, which are healthier options, are more expensive than boxed, canned, or fast foods, which are less nutritious. Food assistance programs such as Meals on Wheels and congregate meal sites are available for the elderly for a very low price, yet only 1/3 of the elderly use these federal programs. Driving is the main means of transportation for Americans. Driving ability tends to decrease in the elderly due to declines in sight, hearing, and reaction time, as well as difficulty getting in and out of cars. This forces them to depend on other means for transportation. There are currently 8.4 million older adults that depend on others for transportation in the United States. Although public transportation is available for the elderly, some cannot afford it or have a hard time accessing it due to disabilities. These difficulties in driving and finding transportation can lead to elderly not going to the grocery store to pick up necessary food items. This can lead to a decreased food intake. Those elderly who can still get to the store often have difficulties with walking around, bending down, reaching up, and transporting the bags from their car to their home. Difficulties shopping for food has been shown to be a barrier to good nutrition in the elderly and a risk factor for protein energy malnutrition. Depression is a disorder that affects the mind and body. It is often believed that depression is a normal part of aging, but this is not true. There are more than 2 million Americans 65 years and older that suffer from depression. This disorder is associated with chronic illness, common later in life, widowers, and older adults with high health care costs. Depression can lead to a decrease in appetite, poor food intake, and weight loss. Depression is also shown to be a risk factor for malnutrition in the elderly. This disorder is often treated with medication called antidepressants. These medications have many benefits as well as side effects. Side effects such as taste changes, stomach irritation, increased or decreased appetite, and weight gains or losses can impact food intake. Another change that commonly occurs with age is the increased use of medications. Medication use is extremely common in the elderly due to increased chronic disease. Nearly 75% of older adults take one or more prescribed medications. The average elderly person takes an estimated 5.7 prescriptions daily, and nursing home residents take an estimated 7. Polypharmacy is a concurrent use of 9 or more medications commonly seen in elderly in the nursing homes. As the number of medications increase, so do the adverse side effects. Around 15% of hospitalizations of elderly are due to adverse drug reactions. The use of so many medications can cause unintentional weight loss, malabsorption of nutrients, gastrointestinal symptoms such as vomiting and nausea, and loss of appetite, which may affect food intake and nutrition status. Next, we will discuss how these age-related changes affect the nutrition and health status of the elderly. Each of the age-related changes we discussed had some direct or indirect effect on nutrition and health status, increasing the risk for malnutrition and dehydration, two conditions that are very serious in the elderly. Malnutrition is defined as an excess or deficient food or nutrient intake. Older adults are at an increased risk for malnutrition due to decreased nutrient absorption and energy needs, decreased food and fluid intake from a decline of senses, increased medication usage that affects appetite and food intake, depression, which is seen in many elderly that affects food and fluid intake, shopping and transportation difficulties, making it difficult to get to the store and shop for groceries, and finally, eating dependency. Depending on someone else to get food and fluids can lead to a decrease in food intake. Malnutrition can lead to an increased frequency of pressure ulcers, prolonged wound healing, and decreased immunity, leading to a higher risk for mortality overall. Dehydration is defined as the excessive loss of body water. Risk factors for dehydration include a decreased sense of thirst, high protein intake, which increases fluid needs, decreased kidney function, which may lead to fluid restrictions, increased urine output due to certain medications such as diuretics or laxatives, and the dependence on others for beverages. Dehydration can lead to blood pressure changes, increased amounts of falls, confusion, altered effects of medications, and an increased risk for mortality. Due to the age-related changes, elderly are at high risk for malnutrition and dehydration, increasing their risk of morbidity and mortality. Maintaining an adequate nutrition status is crucial to this population for overall good health, decreased exacerbations, and increased control of disease, and a good quality of life. In summary, aging is an inevitable factor of life. With age comes many changes physiologically, psychologically, and socially. These changes all have an effect on nutritional status, putting elderly at an increased risk for malnutrition and dehydration, which are associated with increased risk for mortality and morbidity. Hence, it is crucial for the elderly to maintain an adequate nutrition status for disease control and to maintain good health and quality of life. You have now finished Module 1. Please move on to Module 2.